I'm Szenan-Balance from Szenan-Balance, the acupuncturist. Wow. Today's topic is depression causes. So we're going to talk about what causing depression. And in Western medicine's theory side of view, and as well as Chinese medicines. Right? Let's have a look. Let's get to the Facebook first. If you're on Facebook, please give me a thumbs up. If you are on YouTube as well, please give me a thumbs up as well, and leave a comment down there and say hi to me. Thank you. And if you're on Facebook, please share this live video as well. So I'm going to this Facebook right now. Hi Eric, how are you? I'm going to share this live video into my page, into my personal account. Here we go. So I have new feed. Okay, that's it. Then go back to Instagram account. That's it. All right. Our topic today is depression causes. Well, there are several possible causes of depression. They can range from biological and circumstantial. Okay, and common causes of depression that include family history. So, what family history? If you are at a higher risk for developing depression, if you have a family history, it means your family, your mom and dad, or your grandpa and grandma suffer from depression or another mood disorder, emotional disorder, then you're in a high risk. Okay, and that's because we talk about this in other live video. Is we learn from our parents, right? So we learn from our family members, like if they when things happen and how they react to things, So being a parent is important. When things happen, how you actually react to it, respond to things. That is important because your kids is actually learning from it. Okay, yeah. So early childhood trauma. So some events affect the way your body react to fear and stressful situation, right? So trauma, there are a lot. Okay, like probably family or sexual abuse. They all can lead to emotional disorder, such as depression that we talk about today, and as well as anxiety we talked about last topic, right? Brain structure. So there's a greater risk of for depression if the frontal lobe of your brain is less active. So, however, the scientists don't know if this happened before or after the onset of depressive symptoms. Not sure. We just know that when depression happened, that the brain structure, the frontal lobe of the brain, is getting less active, and maybe because of the depression, the causing that. So it's probably not a primary causes. We're not sure. No one know about it. Okay, that's on Western medicine. Okay, so medication conditions. Certain conditions may put you at higher risk, such as chronic illness. The chronic illness can be what? High blood pressure, diabetes, arthritis, chronic pain, arthritis, or fibromyalgia, and insomnia, or ADHD. Okay, those medical conditions can lead to depression. Right? So depression can happen itself as a primary disorder, and also can cause from the other medical conditions. Right? Drug use, like a lot of arthritis, joint pain, this can lead to depression too, because you feel useless, and you feel you lost your ability to do things, and that leads to depression. Yeah, and you're very sad. Drug use. So a history of drug or alcohol misuse can affect your risk. Yeah, I've seen this kind of person, and they getting depressed because they were alcoholic, or they use some drugs that overuse it, and into addiction issues that been addicted to some drugs, and that can lead to depression as well. So about 21% of people who have a substance use problem also experience depression in addition to these causes. So other risk factor for depression include, there are others, so low self-esteem or being self-critical, personal history or mental illness, certain medication, and you will feel they are very, very, I don't know how to say this. If you look at all the antidepressant, they have a side effect of depression or anxiety. It's so funny. The drugs is treat this problem, and it can cause this problem too. I don't believe it or not, you can check on it. But when we come to Western medicine, I can list out, I can name it out, the medication and as well as the side effects. So when patients come in, if they're on medication, I'll always check the side effect. I can't remember all of the side effects of the medication, but you should check it and let your patient know what are the side effects of it. All right. Stressful events such as the loss of a loved one, economic problem, or divorce. Okay, so when those things happen, an event, stressful event, you break up with the girlfriend and boyfriend, all those things. Hey, getting sad is normal, right? But if this happened for months, over 3 months, that's not normal. If just a few weeks, 1, 2 months, and you got better without any medication, and that's normal. That's normal. Okay, don't put yourself into medication if you get divorced or um, uh, uh, if you break up with someone. Okay, so feel sad, but low. That is normal sometimes, but you get better, right? So don't put yourself into take medication so early, right? Especially a doctor, most doctors want to give you drugs straight away, and I don't agree with that. Okay, there are a lot of things that you can do aside from medication, right? So many factors can influence feeling of depression, as well as who developed the conditions and who doesn't, right? So the causes of depression are often tied to other elements of your health, right? So often. However, in many cases, healthcare providers, including me, are unable to determine what's causing depression. Too many factors, it can be a combination one, and we find it very difficult to determine the primary cause. That's very, very difficult because a lot of things that are causing your depression, it can be just a trigger, not the primary cause. And you want to track the primary cause, so difficult, right? So over here we talk about Chinese medicines, right? So depression, we put it down here, So for the organ theory, Chinese medicine organ theory, right? Liver and gallbladder are the organs that function out of balance, and it can cause depression. Of course, fear, sadness, fear and sadness. If you're very sad, very low in your emotion, and for a long time with sadness, you end up with depression, fear as well. Unhappy. If you can't enjoy your life, unhappy, that can lead to depression as well. So have a look on here. Heart, small intestine out of balance, lung, large intestine out of balance, kidney, bladder out of balance. So those organs out of balance can lead to depression, not just liver and gallbladder, but most cases, most time is lead to the liver and gallbladder. Now, when we talk about organs function in Chinese medicine theory, organ theory that control the physical function as well as emotional energy, right? So if the physical function out of balance, let's say if you have heart function out of balance and you're not sleeping well, insomnia. So insomnia can lead to what? Depression, right? So primary disease, insomnia. So then you end up unhappy, then you lead to depression. Let's talk about spleen and stomach. Spleen, stomach, you get bloating, painful stomach, diarrhea, and that's going. And you're so worried about this. And this primary physical function out of balance can lead to depression or anxiety, right? Does it make sense? So same as the lung out of balance, asthma, skin problem, or I've seen skin problem, a lot of people, skin problem, painful and itchy all the time throughout years, and they end up with depression because hopeless, if they are hopeless, okay? So that's according to Chinese medicine. So when it comes to the course of Chinese medicine, we really need to sit down and fill in a form and go through everything to check which organ out of balance causing depression. It can be a lot of few, can be just one, right? So if you on our Facebook page of our clinic Sense of Balance, you suffer from depression and you want help from us, we provide acupuncture, Chinese medicines, and Ho'oponopono method and diet change. Why diet change is so important? We'll talk about in the next few chapter live video. Okay, so call us on 0784679956, 0784679956. So you can come. Oh, sorry, got to the wrong side. 0784679956. All right. So so you come to us and we provide a free pre-assessment. So it's free up to 15 minutes, and we can have a look on you and organs, and then we can go to initial examination. And the initial examination, we sit there, examine you for about an hour, and that is, only cost you $40. We give you a plan and let you know how we can help you, what solution, and how long would it take, and how much would it cost you. All right. Stay awesome. I'll see you next time. Bye bye.